Okay, this one's going to be about muscles of the hip, so page 114 of your lab manual. And we're starting with our posterior superficial hip. This image, just a word, this is from Body Worlds. So this is an actual human body that has been donated to science, and they have preserved the body in a way where they inject plastic, so some kind of silicone or plastic into the body, and had to do a very good dissection, as you can see. So we're looking at sort of, this region. And we're going to begin with muscles that many of you have heard of before. So our gluteus muscles, we have three of these: gluteus maximus, gluteus medius, and gluteus minimus. So let's start with our gluteus maximus. So this is, our most superficial and biggest muscle in the body. So if you've heard that, it's correct. It has a wide origin on the ilium, sacrum, and coccyx. So you can see the ilium here, the sacrum, and then coccyx. And then the muscle fibers will insert laterally onto the gluteal tuberosity of the femur and the iliotibial tract. So if you remember your bones, that gluteal tuberosity of the femur is the posterior sides, that sort of bumpy region of the femur. So it's a posterior landmark on that femur. And then you can see in this image how the muscle also bleeds into or becomes this nice large piece of connective tissue. This is actually dissected away. So this piece of connective tissue actually wraps the entire thigh. So it is especially thick on the lateral border. So this area is called the iliotibial band. It's also called the iliotibial tract. Either with the word tract or band is fine. And that is the fascia lata, is that connective tissue that completely circumscribes the thigh. So your entire thigh has this connective tissue wrapping it. It's just especially thick here on the lateral edge. And if we go back actually to our first picture, we can see this piece of connective tissue, right? You can see how formidable and thick it looks. This is your iliotibial tract. So it's named after where it comes from and goes to, right? So ilio, it's arising at the ilium, and then tibial, right? So it's going to go past the knee and insert onto the tibia. It's a nice big tract. All right. So let's look at the actions of our gluteus maximus. We have extension and lateral rotation of the thigh. So extending your thigh is taking your leg and sort of pushing your thigh behind you, or if you are sitting down, your hip joint is going to be flexed, right? You have a small angle there, but when you stand up, you're using your gluteus maximus to extend the hip. So that's another way you can think about it. So that's extending the thigh. I'm saying the word hip because it's the hip joint, but you're moving your thigh. So you can either say extend the hip joint, or you can say extend the thigh. And then lateral rotation is to sort of rotate your thigh out or externally. And you can kind of tell that this is what the muscle would do because it has fibers that are slightly oblique, so it could twist laterally. So let's also look at the next picture here. Well, we can see gluteus medius already. So gluteus medius is truly a medial muscle. It's not posterior. It is on the lateral edges of your hip. So the origin on the ilium, as you can see here, and then it inserts onto the greater trochanter of the femur, as does gluteus minimus. So gluteus medius and minimus are identical in their everything, origins, insertions, and actions. So they're synergists of each other. And so gluteus medius is very lateral. You can see it. There's a part of it that's superficial, and this is going to abduct. It does not extend. So that's one big difference between your gluteus maximus, which extends, and then gluteus medius, which does not, because it's very lateral on the thigh, right? It's not going to pull your femur backwards. It's going to raise your femur laterally. So it's an abducting action. And then it also medially rotates because these fibers will actually come forward and help to turn your femur inward or medially. So I hope you guys can picture that. I just want to show you, this picture is the fascia lata. So we can see our whole leg actually has a fascia around it. Here's our fascia lata, and then here is that especially thick iliotibial tract. All right. So let's look at the next deeper muscles, so posterior deep muscles. You guys will be happy to know that I do not teach the gemellus or internus, the obturator muscles. So the only one in this box that I do require is piriformis. So let's take a look at the piriformis. And it's actually not in this picture, but I will point out, here's gluteus maximus, here's gluteus medius, which is very medial. And you have to cut away, if you look at this side, right, we're cutting away gluteus maximus, cutting away gluteus medius, and we can now see gluteus minimus. So gluteus minimus is deep to gluteus medius, but it has the same origins and insertions. All right, and then here, hopefully you recognize that greater trochanter of the femur. Oh, let's talk about the IT band before we move on to piriformis. So the IT band can cause problems. It's called IT band syndrome. And because this really thick piece of connective tissue does cross the knee joint, when you have repetitive motions at the knee, so people who cycle, you can see the list here, cycle, hike, row, or play soccer, any sort of action that you bend the knee a lot, this rubbing action here at the knee as you bend and extend it can cause friction, and you can cause inflammation there. So that's called IT band syndrome, because that band is so thick that it can, it's very inflexible, and it can cause problems there. So it's a localized, you can see a localized pain on the outer knee is IT band syndrome. So just be aware of that. If you're a runner and you have pain on the external or lateral knee, it may be that. You can look up how to stretch it out. Lots of stretches for that IT band. All right, so here we have piriformis. Piriformis is a muscle that is deep. So on our models in class, right, we would take off the gluteus maximus and we would see piriformis right here. On the image here, it's here. So the piriformis is easy to spot because it has a really, really large nerve emerging from beneath it. So this nerve, you should know for this exam, it's the sciatic nerve. So the sciatic nerve is a nerve. It originates in the lower spinal cord, right, of course, and then it comes out. It's going to weave its way through your hip, your coxal bone, right? So remember that greater sciatic notch and the lesser sciatic notch. And then the piriformis lies on top of it, and then it'll emerge from your muscle group from the piriformis. So when you see the sciatic nerve and you see that the first muscle that lies on top of it, that's piriformis. So I have here that the piriformis is the source of some cases of sciatica. So I also want you to know this problem. So sciatica is some kind of impingement or pinching or some kind of problem with the sciatic nerve. So the sciatic nerve is a nerve that runs all the way down the posterior hip here. It runs down the posterior thigh and all the way down the leg into the foot. So people who have problems with the sciatic nerve can actually feel any kind of nerve issue all the way down to their foot, so all the way back their leg. It can be pain, it could be numbness, it can be tingling, it could be muscle weakness. But there are several causes of sciatica. One of them, right, just one of them is it could be caused by a very tight piriformis muscle. So if this muscle wasn't stretched out and it was sort of short and tight, it would push on that sciatic nerve, maybe more than usual, and that pressure can cause sciatica. So so here's my slide. You can read through this on sciatica. This is a great piriformis stretch. So if you ever have issues with sciatica, this is something that they recommend you do. So this is what they call in yoga a figure 4 stretch. But what you're doing is this thigh right here, this is what you're stretching out. This is the side that your piriformis muscle will be stretched and hopefully relieve the pressure on the sciatic nerve. All right, moving on. So we're ignoring the rest of the muscles there. We're coming into the anterior hip. There's 3 muscles in this area. There's the Tensor Fasciae latae, there's the iliacus, and our psoas major. So let's see. I'm looking for it. So this image, I guess, only shows you the iliopsoas group, and the Tensor Fasciae latae is not in this image. So let's start with that first. So this muscle here And number 2 here, these are the tensor fasciae latae muscles of the body. So we can start with just the diagram. Iliac crest is an origin, so you can see clearly how it has that origin on the iliac crest. And then, you know, of course, as the name implies, tensor fasciae latae, it's going to tense the fascia lata here. So the insertion point is into that fascia lata, or the iliotibial tract. And then the action of this muscle, right, is to abduct. So you can imagine that if this muscle pulls up toward its origin, that's going to help abduct or raise your thigh laterally away from your midline. And it also helps to stabilize the knee. So this is interesting because these tendons, right, that surround the knee are sort of tugged by their muscles. When you have stronger muscles, right, they are going to pull on the tendons a little bit more and they can stabilize the knee. So this muscle here, since it does insert onto the IT band, and this IT band does cross the knee laterally, it does have a role in stabilizing the knee joint. All right, so let's move on to our iliacus and our psoas major. So we can go back up to this picture. All right, so these two muscles are grouped together and a lot because they have the same action, they have the same insertion, and they act together, so they're synergists, and these are as a group called the iliopsoas muscles or the iliopsoas group. So the P is silent here. Separately, they are the iliacus, so let's start with that one. The iliacus, you can see, lies on the ilium, so the origin is the fossa of this ilium, so you can see this depression here, that's the iliac fossa. And then we can see it coming forward, going underneath our inguinal ligament, and then coming out superficially here and inserting on the lesser trochanter of our femur. The psoas major here, right, you can see the origin's different. The origin are on the vertebrae, the last thoracic vertebra and the 5 lumbar vertebrae, excuse me, and then also coming together with our iliacus and inserting onto the lesser trochanter of the femur. So these are commonly referred to as your hip flexors. If you were to bow down, like bend over, you are using these muscles. When you're sitting, you are using these muscles to help you sort of close down your hip joint. So your hip flexors are used a lot in normal life because you're bent over, you're driving, when you're sitting, you're bending forward a lot. These are the hip flexors. So just wanted to point that out, and it is superficial. So when they come together here beyond the inguinal ligament, they do become superficial and you can see them. The slide on the iliopsoas muscle group. So this one here is going to be the psoas major. The one in the fossa is your iliacus. This gray line, all right, that's going to be our inguinal ligament. And then here, this is your iliopsoas group when they come together. So this muscle can also be referred to as the iliacus, but go ahead and call it the group name iliopsoas. Whereas, because it's very difficult to tell which one's which, whereas above your inguinal ligament, I would like you guys to, if I tag any of these separately on a diagram, you name them separately. So let's go over here. This is your psoas major arising from our vertebral column. This is your iliacus. And actually, this diagram does not show it coming out superficially. Oh, actually it does, but it's missing the inguinal ligament. So if we drew in an inguinal ligament this way, right, this portion of the muscle where my cursor is would be this region right here. All right, so that is about it for the muscles of the hip.